There we go. Alrighty. Good evening, everyone. My name is Diana Wright. This is the Diana Wright Show live online, and we are with our favorite doctor in the house, Dr. Melanie Simpson. She joins us today, and I have some crazy questions. I don't know. She's gonna not like me very much after I have these questions that I have here. I'm not gonna start out with one that's too brazen, though. I'm gonna kind of just wheel her in a little bit. So, okay, Dr. Melanie, you were asking me about my my lunatic poster.
Yes.
My good friend Paul, who was a star of the movie, gave me that poster. I went to the premiere in Jamaica at the time, because I was a big celebrity at the time, so I got invited to those things.
Okay.
So I got the poster, and I thought it was such a fabulous poster that I framed it. Yeah, I framed it and put it on I've been traveling with it too, it left Jamaica with me, came here, went to Atlanta, came back. So it's a busy poster.
Nice, very nice.
Yeah, thank you. Okay, Doc, welcome to the program, and thank you so much for joining us this evening. Just reminding folks that our thrust on the program every single day is to love yourself, as we encourage you to do so. It's, love is a big word, and all you need to do is just put it in the middle, and, we get I love me, and it's good, right? So, do you have any sound on by you there, Doc? You need to turn that down a little bit, because I'm hearing myself back.
Double check that.
Yes. So if you double check that for us, and then we can get...
Is that better?
Yes, that's better.
Okay.
Okay, great. Alrighty. All right. Okay, Doc, we're going to start right off the top with menopause, because there's a new study out that menopause is actually affecting the memories of women in their 40s and up. So what do you have to say about that? And it's also affecting them in another negative way, not just memory loss, but also depression. Are you seeing that?
Well, with regards to, I just want to say, first of all, good night to our listening audience. Welcome to our program.
Mm-hmm.
With respect to your question, unfortunately, there are many women who experience early menopause. And so by this, I mean before the age of 50 or 50 plus, if you will.
Mm-hmm.
And so one of the concerns that a lot of women have is that they notice a decline in their drive for life itself.
Oh.
It doesn't mean that they're suicidal by any means, but in many cases, because of the decrease in the hormone levels of estrogen, a lot of these women experience depression symptoms. And so they're not as sociable or as friendly as, once in the past they might have been. And of course, this presents a big concern, because if you're somebody that was extremely sociable and had, a great group of friends that you used to enjoy hanging out with or doing activities with, or even your significant other, then once this transition occurs or this change occurs in your behavioral pattern, then of course it raises a great deal of concern for those who are, closest to you or who are familiar with you. In addition to that, a lot of these women experience changes with regards to their sleep patterns, because, they experience hot flashes and night sweats, and they just feel overall very anxious in many cases and irritable. And so because of this, that also affects their ability to function during the daytime, because they spend most of their nights in many cases changing clothing just to make themselves comfortable. And then they have to engage in intimate relations with their significant other when they're experiencing this level of high stress, then it's very, very difficult in that case too. With regards to the memory loss, I have not been very much exposed to a lot of patients who have complained of changes in their memory with regards to menopause. But I do believe that that's possible because of the changes in the hormone levels. And estrogen is one of those hormones that the body needs for so many different things.
Right.
And once you have a change in this particular hormone levels, it can affect so many other areas of your life. So it is possible that these women can experience changes in their memory because of that decrease in that particular hormone.
Okay. They're also saying in the study that women who have lots of hot flashes are more likely to lose their memory. And of course, the same thing happens, they say, in pregnancy. Well, they call it momnesia. So, they have a name for everything these days.
Right.
So, momnesia, I guess, and they're correlating. The study was kind of correlating it, that similar things happen to women when they're pregnant. Because, I guess they say when you're pregnant, the baby takes away some of your memory. So, okay. All right. I have to ask you this question. Why is sex seemingly so important to men more than women?
Why?
Yes.
I believe that you probably have to ask that of a male, but I will try my best to answer that question.
No, I'm going to ask Dax this question on Thursday, but I wanted to hear it from you from a medical kind of perspective.
No problem.
Yes.
Like I previously said in another program, men are very visual people. And so with women, we are also
aren't we visual too? Aren't we visual also?
That's what I was saying. Women are also quite visual, but in many cases, we are more stimulated based on touch and also hearing. Mm-hmm. And so for us, it's more on the emotionally driven side that we become stimulated to want to engage in sexual intimacy. But with men, it's kind of like all day long, their eyes are walking around, kind of, scouting out, if you will, those that they find to be attractive. It doesn't mean that everybody that, they see that they would like to be intimate with. But men in general are very much in tune with the idea of intimacy in that setting. Whereas with women, there's so many other distracting factors that we have during the course of a day that women are less likely to be focused on just sexual intimacy. And so that's the reason why we always say, even if you read the book, The 5 Love Languages, that's why they always say it's very important that a woman from the beginning of the morning, so if you're interested in engaging in sexual intimacy on that night, then all of that stimulating her emotions begins from the morning. And then it carries on throughout the day before she's into that actual place where she's willing to be engaged in sexual intimacy. But with men, it's totally a different ballgame where, they're just visual stimulators and, it kind of goes from there.
Okay. All right. I'm going to start with the big questions now. Just reminding folks that you're tuned to the Diana Wright Show live, and my special guest is Dr. Melanie Simpson. She's a general practitioner, and she joins us every Tuesday, and we talk about the things that you really don't want to address. Some of these women who have menopause, they're going, oh, I'm feeling hot. Is the room hot? Put up the AC. No, you're having a senior moment. Hello.
Right.
So a lot of women just don't want to address these things, but, we're brave enough to do so. Here's one of the big questions for you. Could I possibly be, and when I say I now, this is someone asking a question, not me asking the question, okay? Because I don't want anybody thinking I'm asking this for myself. But then again, it could be possible. Could I possibly be allergic to sperm? To your significant other's sperm or your spouse's sperm?
To be honest with you, it's funny you asked this question because this question has been posed previously by someone else.
Oh.
I don't think necessarily that it's so much that someone is allergic, if you will, to their significant other's sperm per se. But with women, we produce a particular substance that allows that environment to be very acidic because the idea is the body does not want any foreign material to enter. And so the way we are made up as women, our body aims to resist the idea of fertilization. So even though it was intended that we reproduce, be fruitful, and multiply, our bodies are created because the idea is to prevent us from catching germs, if you will, from sexual intimacy. And so there are women who, once they engage in sexual intimacy, do develop infections. And by this, I don't necessarily mean chlamydia or gonorrhea or herpes, but there's some women who end up with bacterial vaginosis, and that's not a sexually transmitted disease. But what happens is the pH of the vaginal canal changes. And so normally your body needs to be in an alkaline state. So normal alkalinic pH is 7.0. But in many cases, because of sperm being introduced, their pH ends up being, maybe 6 point something, or, in many cases they're dehydrated, and that contributes to their bodies being more acidic than it should be. And so they can develop bacterial vaginosis, and by this they experience a vaginal discharge that usually has kind of a fish-like odor to it. And in many cases, some people might say it has like a pale yellow color to it. But, there are many women that present and they say, oh, I've been with the same individual and we are monogamous and we have not used condoms. And all of a sudden I find myself itching, and it's not a yeast infection.
Oh, it's not?
So it's possible. It's possible.
Okay, so we should not believe that it is indeed a yeast infection, because I think a lot of women, I had a girlfriend one time who used to say to me a long time ago, I am allergic to my husband.
Wow.
And I used to crack up, because that's when we were in college. She just happened to have gotten married and have kids long before we all did.
Right.
And she was always complaining, I think I'm allergic to my husband, because every time we have sex, but I'm getting these infections, or she was calling it a yeast infection. So it's different from a yeast infection, right?
It's completely different, because a yeast infection is from the bacteria, Candida.
Okay.
So when you have bacterial vaginosis, that's Gardnerella vaginalis is actually the organism that causes BV, as we it's abbreviated. And so that particular treatment is completely different from somebody who presents with a candidal infection or a yeast infection. Not only that, if someone is a diabetic, their risk of getting a yeast infection is a lot higher, because in many cases, their blood sugars sometimes are not controlled, and bacteria like warm, hot environments. And that's the other reason why we encourage women to utilize cotton underwear, because we do sweat. And in many cases, a lot of women don't think too much of it. You know what I mean? If they sweat. But the thing is, sometimes women will sweat, and guess what they do? Now they have tight jeans, and so they wear the tight jeans, and there's actual sweat. So now you're a breeding ground for yeast to form, and then they end up having this kind of infection. So it's completely different, but it can happen.
Okay, all right. So ladies, you now know that yeast infections are not when you're allergic to your husband. To his sperm, that is, not the rest of him. Okay. All right. Here's another question. Am I wrong to expect sex when I'm pregnant? So if someone is pregnant, are they supposed to be having sex? Are you saying to them as a doctor, no, you shouldn't be?
It's actually safe to be in sexual relations with your significant other when you're pregnant. I mean, there's so many other creative ways of how people allow themselves to be sexually intimate when there's a pregnancy. Because, of course, once that gravid uterus, your abdomen is gravid, as they call it, because, now you have a protruding abdomen kind of in the way, depending on how you engage in intimacy with that person. And so a lot of women are more stimulated, actually, to be in intimate relationships with their significant other when they are pregnant, because your hormone levels have changed.
Right.
And not only that, for some men, it is more a turn on, if you will, when the woman is pregnant, that he will want to engage in sexual intimacy. This is not to be graphic, but everything enlarges. And so for some men, that is what they, describe, if you will, as their attraction to this woman. It is, they're excited about the pregnancy, but at the same time, they don't want to lose that intimate relationship that they have with that person that produced this pregnancy in the first place.
Right.
And then there's some women who completely are turned off or grossed out, so to speak, by the idea of intimacy when they're in a pregnant state. But
I can imagine that. I can see that.
Well, everybody is different, but what we have to remember as females is he still needs to remain attracted to you. It's not get pregnant and when your baby drops out, so to speak, then all of a sudden he's going to be interested in you again.
Okay.
But you have to maintain that interest throughout that entire course of your pregnancy. Yes, your hormones change. Yes, emotionally you might be stressed. You might be very uncomfortable because of the back pains that occur, and sometimes you have what they call ligamentalgia as the ligaments stretch, and you might have the abdominal discomfort, and your feet swell and you don't feel as attractive. That's even more reason to be engaged in communication with that significant other, because all of these things are going to help you get through that pregnancy.
Okay, and I was looking for your information here, and I think I did a clean house today, and I kind of must have dumped out some stuff.
That.
So
to
please do.
Contact me, the number is 561-434-5678.
So it's 561?
That is our office number. Again, 561-434-5678.
434-5678?
78, correct.
Okay, 5678? Seriously?
That's correct.
Oh, 434-5678?
434-5678.
Wow. I never made the connection with the number before. Do you see what I'm talking about? 5678. Yeah, I'm okay. I just got it. Oh, that's interesting. I've been saying that number so often, and I just got the end. It's easy to remember. Very easy to remember.
Very, very easy.
Okay. Ooh, I don't think anyone else got it because I didn't get it. Okay.
The prize goes to you because most people actually don't realize that.
Yes, I'm like, wow. Because you were saying it, I think that's the reason I got it, because I'm always saying it. So that's probably why. Okay, here's another question. I'm not quite sure if you are aware of something called an O shot and a P shot. An O shot is something that the dermatologist / plastic surgeon in Boca is actually injecting between your bladder, that passage there, and it kind of brings back your libido. And for the woman it's called an O shot, and for the man it's called a P shot. And this is it's not giving away, I'm sorry, $1,500 for it in Boca Raton. And I forgot the name of the plastic surgeon, but I just was curious to know if this is something that you're aware of, or is this a new thing, or what is it?
It's funny you brought that up.
Because what they did, I will tell it to you as I saw it on television. They put they took the person's blood, and they put it in a vial, and they put it in this thing that you turn around, whatever you doctors call that thing, right? And then when they took it out, it had one color thing at the top, which was the biggest amount. Then there was another thing in the middle, and there was another thing at the bottom. And they take the thing at the top, which is the most of it, and put it back into your body, hence making you have libido. The woman that they tried the experiment on was 62 years old, and she was there going, oh, I feel better than when I was 18.
Well, I cannot attest to that. I will have to take her word for it.
Yes.
I have no idea. I mean, most people get, in males, a lot of times they have low testosterone levels. And so, it could be secondary to medications or a chronic illness. And so because of that, they often come in for us to do testosterone injections. Of
Right.
course, after obtaining blood levels and seeing what their levels are, we offer them testosterone injections,
Right.
or sometimes a testosterone gel that can also assist with increasing their libido. But I am not very versed on that whole procedure.
I think
that's
it's
now
brand
taking
new. I think
place.
it's brand new.
So I'll
So
have to do some more research on that.
okay, I'd appreciate that because I'd love to inform my viewers about
Yeah.
this, because I'm sure if this is something, we'll have women coming from all over the world to this lady in
Yeah.
Boca. Okay, all right. Next question. There's someone wanting to find out if I'm not having an orgasm, is it physical or mental?
It could be both.
Oh, it could be both.
It could be both.
Okay.
In many, many cases, hormonal levels contribute to this. If you remember when I had done the stages of, coming to a climax,
Right.
in terms of intimacy and how, your heart rate changes and your respiratory rate changes and
Right.
muscles contract and, some muscle groups are shut down, so all of this can take place. There are many people who, from a psychological perspective, are affected in being able to have an orgasm. For example, someone who was raped or, any kind of physical violation of that individual can cause an aversion or a turn off from the idea of being intimate. So they may lie there, so to speak, but nothing happens because emotionally they're not there.
Okay.
And it's very sad and unfortunate, but it does happen. And then there's some women who, in some cases, have physically had situations where, there's verbal abuse, and because of that, they cannot really connect with that individual because there's a feeling of a sense of threat regarding that person. And so whenever they're in that space, because remember, when you're about to be intimate in that setting, you're very vulnerable at that point because you want all your muscle groups to relax so you can actually engage in sexual intimacy. But in many cases, a lot of these women are physically distressed, they're emotionally distressed, and in some cases, you have some women that they have vaginal dryness, with aging, your hormones level decrease, and they're not able to be as lubricated without assistance of, let's say, KY jelly or some other product of that sort. So it's very difficult for them to get to that place where they have an orgasm as easy, let's say, in the past as they previously did. And so in many, many cases, you have women that complain about, I'm not as attracted to this person and I'm just doing it just because. You know what I mean? Because unfortunately, there are women out there that say that, I don't want to not have sex, and because this person is available, I'm going to make myself available, but it doesn't mean I have to enjoy it. Well, what's the point of having intimate relationships with someone if you're not going to enjoy it?
Amen.
Because remember,
to that.
you're giving a part of yourself to that person. So if that person is getting satisfaction physically and emotionally, or just physically from you, they're taking something from you and you're getting nothing in return. And that in itself makes no sense.
Okay, my special guest inside the Diana Wright Show at the 8 o'clock hour this evening is Dr. Melanie Simpson, and she joins us every Tuesday. We're talking about things that you definitely don't want to talk about. I know that because a lot of you just think that word sex is something that we should not be discussing. But hey, we need to discuss it because lots of things are going on in the sexual world. Don't you see that? Everything on television is just about sexual now anyway, unless you're watching HGTV like me or the Food Network. So, okay, Dr. Melanie, are bumps on a man's penis normal or something for the female to worry about?
Be very alarmed.
Ooh,
That
okay.
is
See,
not normal.
I was afraid to ask that question, and see, there's a good answer. Be very alarmed.
That is not normal by any means.
Okay.
Any male who has any sort of bumps or warts or any kind of lesions, as they call them, on their penis, that by no means is normal, because the penile shaft should be nice and smooth. You know what I mean? And so, you know, you want to examine. I mean, a lot of women would say this is being very graphic, but the more you know, the safer it is for you and the better it is for you to be familiar. So in many cases, it's important. I mean, I understand intimacy. Everybody wants lights out, you know, before a camera in action. But it's very good that you observe, because you might miss something in that process. And this person might have an STD that you're going to now contract, and you have no idea. So genital warts are one of the things that you can notice when somebody has lesions on their penis. The other thing, and they're usually flesh colored. The other things that sometimes people have is they might have herpetic lesions. So, you know, in terms of herpes, they might have those little, you know, you can call them pimples, if you will.
Right.
But they have a very red base, you know, at the bottom. And so if those are present, then that's a sign that there's something going on in that person's body that needs to be further investigated and most likely treated. But it is not normal for there to be bumps on the penis at all. No, that is not normal.
Okay, not normal to see any bumps there, ladies. It should be nice and smooth. And if you'd like to be part of the conversation, even though you're shy, you can give us a call. No one will know who you are. 561-228-1921. That's 561-228-1921. Our special guest is Dr. Melanie Simpson, a general practitioner. So you notice, because she's a general practitioner, I'm giving her questions from the whole gamut of stuff. All right? So, okay, Doc, let's see here now. We have a question here. My husband has a curve in his penis that makes sex difficult. What can they do in a case like that? I'm not even understanding the curve thing, but anyway.
Well, here's the thing. So this is interesting, because we've actually covered this previously.
Yes, but I found these questions online, and there are plenty that women are asking.
That's fine. And I think they're great questions.
Yeah.
But remember when I was saying previously, when I was going through the stages of orgasm, and I was saying at one point that sometimes a man, the more stimulated he becomes, his penis actually gets more curved.
Well, I didn't even remember that.
So it's not that, you know, he was born and his penis was crooked or something like that.
Okay.
That's the case. But in many cases, the more aroused he becomes, the more there's a curve to his penis. So what she has to do is they have to become very creative with the various positions that they might try in order to accommodate what's happening to him. And the fact that he's getting more stimulated during intimacy, that's a very good sign. She just has to figure out with him how to work around what's happening with both of them during that point.
Okay. Does birth control affect your sex drive? If you're taking birth control, and a lot of women are, does that affect their sex drive?
Huh. That is very true. Because remember, birth control serves to prevent a pregnancy.
Yes.
And in some cases, take birth control to regulate their periods.
Right.
So, or their menses. But, you know, because you're tricking the body, so to speak, to thinking that ovulation occurred. And of course, ovulation is what happens prior to releasing an egg, and, you know, you're going to have menses to occur. Once all the other follicles die off, you have what's known as a corpus luteum. And that, once it's broken down, that's what gets shed out of the uterine lining. So if you think about it, in many cases, because you have these changes in your hormone levels, because of manipulation from, you know, drugs being introduced to the body, it can change certain things about how you feel, about who you are. You know what I mean? Because there's a shift in your hormone levels.
Right.
So that can affect your sex drive in some cases. And also, there's some women, they're very excited to be on the pill because they don't have to worry about getting pregnant. So
But then they have to worry about something else now.
all day long if they could, because now that's one less thing for them to think about. But don't forget, while you're busy being on the pill and having sex all day long, you have to protect yourself as well, because birth control can prevent pregnancy, but it does not guarantee that you will not end up with some kind of STD or a sexually transmitted disease.
Okay.
So you have to be alert and aware of that as well.
Okay, so if you are on birth control pills in particular, or even the IUDs now, I hear there's something going on now with the type of IUD that was put in.
The Mirena IUD.
The Mirena, right? And women are having major problems with this thing. Are women supposed to be coming off of the pill for a while to give their body a break, and then they just probably just not to not have any sex at that time? Or is it okay to be on the pill continuously?
Well, there's some women who do prolonged use of birth control or oral contraceptives. And the other thing we have to think about is there are various types of oral contraceptives. So there's oral contraceptives that some women take to not become pregnant. There's some that some women take because they want to change their menstrual cycle. So instead of it coming next week, I want it to come 2 or 3 weeks from now. So I'll take a couple of pills,
Wow.
and then it'll shift my cycle to another time.
Really?
So that I'm just telling you what's out there.
I didn't
Believe
know
me,
that.
Somebody called me for that today. So I'm just showing you how, people can have those kinds of questions, because somebody called me with that question today. So that's possible. And then the other thing is there's some women who they do not want to get pregnant for an extended period of time, let's say 5 years, 7 years. So a lot of those women prefer to have an IUD or intrauterine device actually inserted,
Right.
so they don't have to worry about it, because maybe there's someone who I won't remember to take the pill, or I really don't like to take pills, and so, they would prefer that. And then there's the Depo shot. So Depo-Provera that some women get, which you get every 3 months. So based on the type of contraception that a woman gets, it's going to do what it's supposed to do, which is it's going to alter menses or altogether cause cessation of menses in many cases. A woman should have at least 4 periods in a year. So there's another birth control that's out there called Seasonique, and you only get 4 periods in a year.
Yeah.
And so,
But is that normal though? Is that normal though, Doc? Is that really? Is that normal?
So every season, right? Summer, spring, fall, winter. So every season you would end up with a period. But a lot of people like this because it's convenient. But don't forget, women, it's very necessary that the body shed this lining. It's like cleansing your body of germs, if you will. And so it's very important that the uterine lining does get shed. You know what I mean? And so a lot of people, they don't think too much of it. But don't forget, as great as birth control is, there's side effects that come with it as well. So for some women, just to touch on this briefly, for some women, they're at an increased risk of blood clots. So, they might develop a deep vein thrombosis or a DVT in their lower extremity from being on birth control, because their body becomes hypercoagulable, or their blood is easier to form a clot.
Wow.
In other cases, they might have smoking habits attached to using birth control, and so their risk of other serious complications, bleeding and things like that can also occur. In addition, it's contraindicated if you're a woman that's over 35 and smoking that you even be on birth control. So that's another concern as well. In addition to that, there's something called pseudotumor cerebri. It doesn't mean you have a tumor in your brain, but there's increased intracranial pressure or increased pressure in the brain that can occur as well from some women that are on birth control. So there are many, many factors that you have to consider. And then there's some women who experience heavy bleeding with being on birth control. Like some women are on Depo shot, for example, and they experience more bleeding or even breakthrough bleeding compared to if they weren't, on a shot or any kind of oral contraceptive use period.
Right.
So there's so many other things that we have to consider in the interim while we're thinking about, these as options.
Wow, that was a big lesson, and I'm going in my head If I was a teenager again, I would just say scrap the sex and wait. Seriously. Because all of those things just sound so complicated. Why would I not want my body to go through the natural process of having
And you
a
should.
monthly period? Why would I want to do
You
that?
should. You should. You should.
Yeah, and the fact that I have the option not to, I'm going, but that can't be normal.
Well, if you even think about, for example, just briefly on the IUD, for example, sometimes it gets lodged and lost, as they put it, and sometimes we have to use ultrasound guidance to go get it, so to speak. You know what I mean? Because sometimes it floats somewhere else because it's a very small device.
Yes,
And so
it's a
in
tiny
many
thing.
cases-
I've seen it, and I'm like,
Very,
no,
very
no,
small.
no, I don't want that thing any foreign
And,
object in my
it
body.
can get, it can migrate up because most people, when they have an IUD placed, what are they going to do? Have sex.
Wow.
You know what I mean? And so it will migrate. And so now you have to go searching for it because normally there's a small string at the end, kind of like a tampon.
Yes,
that
like a
every
little
now
tail.
and again that
Yes.
woman should feel for that string. You know what I mean? And it's not a string that, if he's having intimate relations with you, women, that he's going to be complaining about the string that's hanging out. It's not that kind of a situation. But it should be present so that you can actually feel it yourself. And if you get to the point where you cannot feel that string anymore, then you need to contact your gynecologist because
Right.
something truly may have happened and it may have migrated up.
Wow.
So, a lot of people think it's very easy and very
Oh
simple
yes,
to
I've
go
heard people
for-
say, "Oh no,
But
the
there's
IUD,
so much-
just put it in and forget about it," And I'm going,
it.
"No, that's something foreign in your body." So
And the other thing is, a lot of women, for example, Mirena, it's supposed to be for 5 years. There's a patient that I've had in the past that kept it in for 7 years. And it migrated and we had to go and find it. You know what I
Wow.
mean? So it's very important that whatever time frame that you have, and of course you do your normal gynecological follow-up, but whatever time frame this particular device was made for, everything comes with an expiration date. And that's why
Okay.
it's very that you go and you have these devices removed when they should be removed.
right, and don't just put it up there and forget about it. Wow. Ooh, I guess we need to move to the morning after pill. That if
Okay.
you have sex and you think you might be pregnant, then you take. Oh my God! I think the condom is just the best birth control right now. Now that we're talking, it's either you abstain, period, no sex before you get married, or if you must, which you shouldn't be, based on what's going on in the world right now, because I just think these are just dangerous times. Then the condom would seem to me to be the less invasive.
Well, this is funny. With the morning after pill, or what they're calling Plan B,
Yes.
Plan A should be keep your legs closed so you don't have
Okay.
to worry and make a Plan B. I mean, that's just being honest and open.
Yes.
But, a lot of times young women and young men want to engage in adult behavior, but they're
right.
not adults mentally or even physically in many cases. And yes, they might be maturing faster in terms of their physical bodies because of the kind of foods that we have, and there's so many chemicals in all these foods now that everybody is, developing overnight, if you will.
Yep.
But they have to remember at the end of the day, it's about responsibility, and there's always consequences for your actions. And so if you decide that, okay, I'm going to engage in sexual intimacy with this person that I'm in love with, or I think I'm in love with, or whatever the
Yeah,
case might be, or just for fun, I'm going to do it. And then, now it's available that you can just go get it. It's not like previous where, you had to show ID, that you're 18 years old, and, all the strict rules and regulations that were attached to it. Now it's just open and available.
Right.
But one of the things that we need to remember, Plan B is not a form of contraception that should become a habit. And there's some women who make this a habit. It's like some women who get abortions
As a
and
habit.
think of abortions as birth control.
Mm-hmm.
And, this is taking it a step further, but there are people out there that have that mentality. Well, if I had one abortion previously and nothing happened, then if I have a second one, no big deal. But there was once when I remember going to a clinic, and it was like, doing a clinical, and a young woman walked in, which I thought was a violation of HIPAA in itself, but a young woman walked in, and I was brand new to that clinic. I was in New York City, and I was brand new to that clinic, and all I can remember is when a particular employee, who was not even a healthcare professional, to say the least, but just worked in the field, said to the young lady, "Oh, you're back?"
Oh, ouch.
And her exact statement to the young lady was, "This is your fourth time in 2 years."
Oh, my God.
And so, for me personally, being my first day at this place, it was very shocking to realize how much of a reality it is that a lot of these women take birth control in whatever form they choose to be a joke and to be very nonchalant. But it is very, very serious. I mean, you can have an abortion and lose your life. And, now we just saw that doctor that was just convicted.
Oh, my goodness. I thought that was a crazy story. I could not even believe what I was hearing. Was it for real, or did someone make it up or set him up? Or it was just unbelievable, the things they were saying he did.
And it's very shocking, because when you think about it, whether the fetus is a day old or it's 9 months now, a full-term baby, a newborn, it doesn't matter. It's still a product of conception that has now formed an individual. You know what I mean? And you may not know what the eyes look like, or the ears, or the toes, or the fingers, or whatever the case might be, but it's still a life. And so when you can have someone go to a clinic that performs late-term abortion.
Okay, Doc. We're not hearing you right now, so I just... Oops, there you go. I just want to remind you, I think someone is trying to call her. So that's what happened there. So we'll just come back to me. Okay, there you go. Are you back with us, Doc?
Here.
Yes.
Yes. But when you can have a situation where somebody is performing a late-term abortion, that's very, very concerning, because now you have a baby who's almost fully mature at its best, that does not have a chance anymore. And so for young women, I would say, and I would caution them very carefully, think about your actions, because you may be the kind of individual that says, okay, I'm going to take birth control, or I'm going to have an IUD placed, or, worst case scenario, I'm going to have an abortion, but this may affect your ability to reproduce at a later date. And so that's something that really they have to take into consideration.
Yeah, but it's kind of amazing to me, because I think if someone gets pregnant, and we're not trying to judge anyone here, whether you want to have an abortion or not, that's your call as a female. I don't believe that politicians have any place in it and all of that good stuff. But if you find or think you're pregnant, why would you be kind of waiting until you need to have a late-term abortion, unless it is something that is medically necessary? That's a different story. We're talking about normal young people, because
normal, healthy young people.
Yes, and they give these excuses about, oh, I panicked, and oh, I wasn't sure I was pregnant. If you're not sure, go buy a pregnancy test thing from the store, and stop. Why are you waiting? Because to me, if you've decided in yourself that I did wrong, I don't want my mom to know because I'm only 16 and she's going to kill me, why are you waiting to go have an abortion when you are having almost a child inside of you already?
Well, can I say something to you?
Sure.
It's very amazing. This past weekend, I've seen the movie previously, and I actually have a copy of it. But that movie For Colored Girls, I don't know if you've seen that, by Tyler Perry.
Yes, I haven't seen the full movie. I've just seen pieces of it.
Okay. In that particular movie, and I commend them tremendously the kind of stories that he tells. But in this particular movie, there is a scene with a young lady, very bright young lady, very ambitious, who gets pregnant. And it seems to be kind of like, a generational thing. She gets pregnant at a young age, and she's supposed to go off to college, but now mom is very holy, and mom does not desire for her to be pregnant or to make the mistakes that her older sister did. And so she comes to her older sister and finally confesses, or fesses up, if you will, that she's pregnant, and her older sister makes a recommendation of where she can go and have this pregnancy terminated. And so she takes herself and her not-so-smart mind, and she goes and seeks out this place. However, sterile conditions, very undesirable as far as where she goes to have this done. The person was actually pouring alcohol on the instruments to sterilize them. And I'm talking about, like liquor that you drink. She was pouring alcohol on, to sterilize the instruments. And so she goes to have this abortion. Of course, this person clearly is inexperienced, and they're clearly not a physician. And this person actually attempts to perform this abortion, and this young lady bleeds. She hemorrhages quite extensively and ends up in the hospital.
Wow.
So it's just warning to show you that even the best of them can have a bad outcome.
Right. Oh, my goodness. Wow. Wow. So, we're just, I'm like just saying to young people, just wait. Sex, remember Miley Cyrus the other day? She thought that sex was going to be this magnanimous, wonderful crescendo, woo, woo, woo. And then when she did it, she came out and was honest enough to say, well, all the talk about sex, it wasn't that great anyway.
Wow.
So, and now she's engaged and, on and off, whatever is going on there with her. But it's just to show you that young people, there is no need to hurry. Okay? Just take your time and slow down. Slow down. These young people nowadays, they're in such a hurry for things. And is it because we have microwaves and they figure if the microwave is going that fast, that I need to go that fast too. So I'm seriously just wondering about this microwave society that we have, because when I was growing up, I don't remember us being in such a hurry to be adults. I enjoyed my childhood, if you will.
I mean, and by no means am I blaming parents, but it goes back to the relationship between the parent and the child, and also if you kind of revisit the parents and the background they had in being raised, and whether or not they had that level of communication. Because in some cases, they were extremely sheltered. And so when they have their own children, they don't know how to have those kinds of conversations. But if you as a parent are not comfortable talking to your child about those kinds of conversations, find someone you trust.
Or just call me and I'll do the talking for you.
Exactly.
Just give me a call and I'll just do the talking.
The last thing you would want as a parent, I know I would not appreciate that as a parent, but the last thing you want is for little children to be teaching other little children about life, adult issues.
Exactly.
They have no experience.
Wow. Oh my goodness. Anyway, we are inside, and this is so real. It's so real. It happens every single day. Every time you turn around, there's a teenager who is pregnant, who is crazy that she's pregnant, and oh my, I'm gonna tell my mother. You send your kids to college, off to college, and they get pregnant at college, and you don't hear from them again because they're, thinking that, ooh, mom is gonna kill me. Which you probably should be killed. You know what I'm saying? Because seriously, I mean, young people need to take time to, I think we're getting a feedback there, Doc. I'm hearing myself back. Maybe you need to turn something down on your end. It's just that we need to have our children love themselves, because if you love yourself as a young person and you have a goal to become XYZ, your goal should be and your focus should be on becoming that thing. Why is it that the young people now just seem to me to be oversexed? I don't know what it is. Is it the food they're eating, the water they're drinking, or what? Because
I think it's just a society. You know, if you notice, sex sells. It sells
Yes.
everything. The other day there was a commercial. I can't remember if it was Hardee's. I think it was Hardee's. But, you know, there was a girl who was half naked and she was introducing a Hardee's burger. And I mean, this was
Oh.
out of state. But I was saying to myself, what does Hardee's hamburger have to do with her having no clothes on?
Yes.
You know, it just didn't make sense. But that's what they're doing now is sex is selling everything, even cartoons.
Uh-huh.
So
But
even the cartoons that children are watching now,
they're using some sexual
everything
overtone.
has sexual innuendos kind
Yes.
of, you know, weaved into the story.
Exactly.
And so that's kind of where our children are getting these ideas from and are being drawn in slowly because of what they're seeing on television.
I mean, they're selling gelato, and it's such a sexual scene to get to the gelato by Haagen-Dazs. I'm going, huh? What does that have to do with me buying the gelato? And I bought it. It didn't even taste good anyway. It wasn't that great anyway. You know, gelato is only good when you go to Europe. None of these American places can make gelato, okay? They're trying a thing, but it's not working. When you go to Italy, or you go to Spain, or Italy more so than every place else, you try and have some gelato there before you come back to the States, all right? Okay, my special guest inside the Diana Wright Show is Dr. Melanie Simpson, and we are talking about some very interesting things tonight that you need to get your young people engaged in. Mothers, you need to stop telling your children that babies come from the sky, because they don't. They come out of the vajayjay or out of a C-section cut. Please stop. I mean, I cannot believe that this is actually happening, but it is, because I hear it, you know, and I'm going, what? This is 2013. We're not in the dark ages of birth. So
You know what's funny? Funny that you said that. I was just thinking that, you know, when we were growing up, a lot of people would say, oh, you know, it's time for you, you know, if when your menses started, for example, you know, they say, oh, you've become a woman. And I'm thinking in my mind, I understand that I've matured or I'm maturing, but I've always been a woman. I haven't been anything else.
Exactly.
You know what I mean? Or of the female gender. But then they tell you, oh, you know, it's time to talk about the birds and the bees.
and the bees.
I've never heard about the birds and I've never heard about the bees. So I was trying to figure out, where did the slogan come from, you know, about talking about the birds and the bees. But I think it's very important that we are very open with our young people when we're having these conversations. And just like people who do baby talk, if you do baby talk to the baby's only going to reproduce
Baby
what it
talk.
is that you're saying to them. So if you say goo goo gaga all day long, the baby is not going to say, okay, I want some more. They're only going to repeat what they hear. And so if you're not open to talk to your young people about sexual intimacy, they're only going to repeat what it is that they hear from their friends or maybe the internet or whatever the case might be. And I'm not saying that some of these sources might not be good sources,
Right.
but you as a parent are or should be the best resource that they're able to come to about topics like that.
Absolutely. And oral sex is not one of the things that you need to shy away from. You need to talk to, especially your daughters, you need to talk to them about oral sex, because a lot of young people, I hear them talking and they go, oh, oral sex is not sex. Oh, this and that, and oh, you know. And oh my goodness, what a dangerous road you're going down if you're thinking that. And how many other things that can happen. You know, I talk openly about sex and oral sex and the penis and the vagina, because I think those are parts of our bodies that we should be talking about.
Yes.
Because it's our bodies, it's our parts. So why are we so afraid of it? You know, and I just wonder about people. As a matter of fact, I have a question here that someone asked. I'm not very comfortable performing oral sex. Any advice? And I thought, okay, lady, what advice would you want somebody to give you about that?
Well, I mean, it's very simple actually to answer that question.
Okay.
Many people are very shy about trying, you know, different types of sexual intimacies with their significant other.
Right.
However, whatever you're not comfortable doing, that's something that you should be able to express to that individual. And then in many cases, there are times when people can communicate to each other, and there can be a common ground where the person says, okay, well, I'll meet you halfway because I know this is going to make you uncomfortable.
Right.
And so sometimes, just by that sense of reassurance, people actually become stimulated with the idea of doing certain types of sexual, behaviors, or performing certain sexual acts with their significant other based on being able to have a discussion about it and feeling more open and more comfortable. So for this particular individual, if you're not comfortable, nobody's putting a gun to your head, or at least I would hope not.
Exactly.
Just putting a gun to your head to say that you have to do this. So, I mean, we have free will, we have choice, and if you don't want to engage in that particular form of a sexual act, then you don't have to, and you shouldn't feel like you have to. And if you're being coerced or forced into kind of making a decision, if somebody puts you at a place where you have to do or die, or lose the relationship or whatever it might be, then it's very easy to walk away, and you just say to yourself, when that right individual comes along, they will understand this is not something I'm comfortable with, this is not something I'm interested in, and you keep it moving. You know what I mean? That's why you have options. It's like stores. You don't always have to shop at JCPenney's. You can go to Macy's, you can go to Sears, you can go to Kmart, you can go wherever you want to. Doesn't mean shop around for men or shop around for women, but just to give you an idea, you don't have to be in a position where you're uncomfortable and feel like you have to stay there.
All right. Here's another question. This one I think is very crucial to what we're talking about with young people. Do I use sex to feel needed?
Say that one more time. Do I use sex
to feel needed? A lot of women seem to think that sex makes, a man having sex with you, that means they need you. I don't think that's a right.
Wow, this is a very deep question that I'm trying to be very cautious in my response.
Okay.
But you have to use sex as a weapon. Let's start there.
Yes.
That's a problem.
Okay.
If you have to use sex as something, an activity, in order to feel good about yourself, in order to feel loved, appreciated, respected, wanted, desired, however you want to, attach the feelings to it, then that's really a problem, because that's saying there's some self-esteem issues that you have really not tackled, and you're using this as a crutch in order to maintain a relationship. And in many cases, you're not even maintaining the relationship, you're maintaining an activity that you may both enjoy with each other, but this is not how you're going to maintain the relationship. What if he has an unfortunate accident? I don't know exactly how to put that otherwise, but what if there's an unfortunate incident and he can no longer use his penis? Then are you going to say, well, it was nice knowing you.
Nice knowing you, child.
You're not in a position to satisfy me or take care of me anymore, so I cannot be around for you. And then in her case, what if she develops, uterine cancer or cervical cancer or whatever other complications, and she's not able to be intimate like that anymore?
Right.
What is going to be the foundation of the relationship when there's no longer sex as the primary backbone of the relationship? So you have to look at it from the angle where communication with each other, very necessary, because there are days you may want it, he doesn't want it. There are days he wants it, you don't want it. And there may be times when both of you want it, but just not right now. You know what I mean? So you have to be able to communicate with each other. And it makes no sense to lie to yourself and say, oh, he's going to stay with me because I'm that good. Guess what? There might be somebody out there that's much better
than you are. And I tell you what, a lot of women, I hear them say, oh, I'm so good, he ain't going to leave me. Yeah, I've heard that. I've heard a lot of women say that. Wow. Dr. Melanie, my special guest inside the Diana Wright Show. We're coming to the close of the program. 561-434-5678. That's her number. That's 561-434-5678. And you can give her a call. That's her office number when she's not on the show. She's actually a doctor, a general practitioner, no doubt, that can tackle just about any of your problems and, probably guide you to speaking to your young people about this whole sex thing and the microwave actions that they're coming up with. Okay, Doc, one last bunch of questions here. What did I write here now? Is marriage a sex killer and are children sex killers? I just wrote that down on my paper. I scribbled it down. I couldn't even read my own writing.
Is marriage a sex killer
and are children sex killers?
Well, if a couple believes that children are going to kill the intimacy that they have, then there's something they can do about that.
Oh.
She can get her tubes tied. He can get a vasectomy.
Okay.
And you don't have to worry about that problem. So, to say that children are sex killers, for many people, it's actually a stimulant for some people. It's actually an excitement for a lot of couples to be able to have their children, because some couples, believe it or not, fantasize about being caught by their children. Not necessarily that they want their children to see them engaging in the act, but just the thought that they're spontaneous.
Right.
And, possibly Mary might come and knock on the door and, what are you doing in there, Dad? What are you doing in there, Mom? What's going on?
Yeah.
And so some of them have an excitement about that particular thing happening.
Wow.
But to say that a marriage is a sex killer would be like me telling people, just go ahead and freely have sex and don't commit yourself to that person in marriage. Because that's the flip side to that, question, is that some people are going to say, well, if me getting married is going to cause me not to have as much sex as I was having before I got married, why bother?
Right.
Because that's going to take away from what I really want out of this relationship. And so if both parties were willing to commit to engage their bodies, there's nothing wrong with being committed to engage yourselves on a sheet of paper that says, I'm solely committed to you and you're solely committed to me. Why people are afraid of marriage makes no sense to me.
All right.
Because there's some people that you'll meet. Like there's one man I met over the past weekend. He said, oh, she's been my baby for the last 21 years, but she has her house and I have my house, and I don't plan to get married.
Wow.
And I'm thinking, who is this woman, and can I meet her?
She's
please,
crazy.
and help her.
Yeah, we need to whip her upside her head and wake her up.
Everyone. But why just give yourself to someone without some level of commitment being exchanged in return? And a lot of people just kind of say, well, I'm content with the relationship the way it is. Honestly, give me a break.
Yes, it is. Give me a break.
If you buy a pair of shoes, and after wearing them one time, JCPenney says there's a recall on that shoe, and you just paid $700 for those shoes, and they'll tell you there's no more of that shoe that's ever going to be made. Whatever it is you paid for it, we'll give you 10% back. I mean, can you imagine?
Yes.
So instead of getting your full money's worth out of the shoe, you got one wear, and now you're excited about the one wear you got. And now you can't wear the shoe anymore, so now you're frustrated. It's kind of the same thing with a relationship. If you get the taste of the individual and you want more, but they're not committed to you, in his mind or in her mind, they're thinking, I could be with somebody else, she could be with somebody else. And then for many people, there's no marriage because there's no trust.
Right. Okay, all right.
And that's the biggest factor why most people do not get married. Even though they might say, oh, it's not the finances, it's not this, it's not that. Trust is a big issue that many people have.
Yeah. Wow. Okay, Doc. The time has flown away as usual. When you're on, it goes pretty fast. It feels like 10 minutes as opposed to an hour.
Yeah.
But anyway, thank you so much for joining us. And
I,
final thoughts before you go? Anything?
I just want to say to women, be liberated, be who you are. To men, be open, be willing to listen, be willing to communicate. It goes right back to whether you're a parent or you're, just an individual, an adult, you're a teenager, you're curious about certain things. There are books out there that can teach you a lot about what you would like to know. That's the reason you have physicians. You should be able to talk to your physicians about any questions or concerns you have. Mm-hmm. And hopefully, if we don't know the answer, we can point you to the appropriate resource to be able to help you with whatever issues you're having. And just in general, for women, menopause does not mean your life went on pause. It just means you're transitioning into a whole other phase of womanhood. That's all it is. Yeah. It might come with night sweats, and it might come with hot flashes, and it might come with irritability. But who doesn't have at some point any one of those particular symptoms? Mm-hmm. If you're outside and it's too hot, you feel irritable. You know what I mean? You don't have to cool yourself off. You feel irritable. Guess what you're going to do when it's hot? You're going to sweat. And, it's just like if you take things in stride and you kind of laugh about a lot of things,
yes,
then it makes life go by so much easier. Somebody once said to me, stress with ED at the end spelt backwards equals dessert. So enjoy life. Life is like dessert.
Go eat like some cake.
I mean, so many things in life that's being served to you. Just like an entree, you get to choose what you want.
All right, that's a good way to end. And don't forget, Doc, it's the O shot and the P shot that you're going to look into for us for next week. I actually saw it on Channel 25 at 11 o'clock. I think it was last week. I think it was the 21st or something. I'm not quite sure. Okay. Yeah, but if you go online, I'm sure you'll find it because I'm figuring that a lot of people are checking that out.
I will be one of them as well.
All right. Thank you so much and have a great evening. Thank you, Doc.
You too.
Okay. That was, of course, Dr. Melanie. And Dr. Melanie joins us every Tuesday inside the Diana Wright Show. We talk a lot about medical stuff, but also about other things that affect young people, things that parents don't want to talk to their young people about and all that kind of stuff. You join us here and we will try to flesh it out for you. And call and ask your own questions. Don't be shy. So you can give Dr. Melanie a call at 561-434-5678. That's 561-434-5678. Dr. Melanie Simpson, and she's a general practitioner, so she's able to tackle any of your medical problems, not when, just going to a specialist. So give her a call when you can. We have lots more of these questions to ask. Some of them are for Dax Dunn on Thursday evening when we allow men to speak about men's issues. And I have quite a few of these here. And we have lots more for Doc when she comes back next Tuesday. Thank you so much for joining me this evening. And of course, tomorrow morning at the 10:30 hour of the Diana Wright Show will be Dax Dunn. It's Wellness Wednesday. And we're going to talk about what if wellness. What if we were just easy to say, just breathe and you will lose weight and you'll be healthy and everything will be wonderful in your life? How easy will that be? But it's not that easy. You have to commit. So join us tomorrow morning at 10:30 and we will have another session of the Diana Wright Show. It's Wellness Wednesday. If it's Wednesday, it's Wellness Day. All right, so join Dax and myself tomorrow morning. And thank you so much for joining me from around the world and in the United States. If you love something, set it free. If it comes back, it's yours. If it doesn't, it was never yours. As I say, ciao, adios, and au revoir. Well, have a great evening. Be blessed. Stay prayed up and go and do some exercise, which is what I'm going to do right now. Thank you. And simply, I love me. Okay, let's see.